Clear the fog. When it comes to eye health, seeing is believing. If you do not see clearly, there is a problem. Assalamu alaikum and very good afternoon. This is Dr. Asia, Assistant Medical Director and General Practitioner at Prime Health, with you from our official social media channels, YouTube, Facebook, and LinkedIn. Many conditions can impact eye health, such as blood pressure, diabetes, stress, genetic factors, age related issues, injuries, and diseases. Prime Health is a leading hub for eye care. Our highly skilled eye doctors use state of the art technology with experience and empathy to deliver the best results. With a comprehensive approach to eye care for all age groups, Prime Health offers the most advanced eye treatments, elective surgeries, emergency procedures for a range of conditions from retinal disease, cataracts, eye infection, dry eye, corneal infection, lazy eyes to implantable contact lenses. To know eye health in detail and to clear the fog today, let me introduce my first speaker on this webinar today. I welcome Dr. Sumit.
Hello.
Hello, doctor. How are you doing?
I'm great.
I would like to talk about Dr. Sumit is a very well-known qualified ophthalmologist with international qualification and rich experience of over 22 years of those 11 years in UAE. Dr. Sumit has worked in many prestigious hospitals. Dr. Sumit has the distinction of being a fellow and member of both the Royal Colleges of Glasgow and Edinburgh, a comprehensive trained eye surgeon with special interest in cataract and glaucoma. Dr. Smith has joined us from Prime Medical Center, Al Nahda branch, but Dr. Smith is also available for consultation at Prime Hospital, Garut. So now I would like to invite my second speaker for this webinar today, Dr. Diljit. We all know Dr. Diljit has been awarded the Diplomate of National Board in Ophthalmology from the world-renowned Arvind Eye Care Hospital, Madurai in India. She pursued fellowship in cataract and advanced phacoemulsification at Shankaria Netralaya, Chennai. After completing her long-term fellowship in cornea and refractive surgery from Dr. Agarwal's Eye Hospital, India, she further underwent training at Moorfields Eye Hospital, UK. With a vast clinical and surgical experience of 17 years exclusively in ophthalmology, she was consultant and department head, cataract, cornea, and refractive surgery at the leading care system at Dr. Agarwal's Healthcare, Hyderabad. Dr. Diljit has been with Prime for more than 6 years. I welcome both of speakers for today's webinar session. For all the viewers who have joined us, I'll request all of you, if you have any questions, please write in the comment box so that in between the session, I can ask our respective speakers the same questions. So I'll begin with Dr. Sumit, my first question for this topic. As we all know, this is clear the fog, so probably we really want to clear the misconcept in and around the eyes. So Dr. Sumit, we all know maintaining a vision as we age requires proactive approach. What are the major causes of vision loss for any individual 40 and above?
Hi, a very good evening to all my dear colleagues and all the viewers here. So the question you have asked is very relevant to the viewers. So the first, there are many causes, but we'll only discuss basically the ones which are more common and simpler reasons which we see on everyday basis. So the first undoubtedly has to be refractive error. Refractive error means when the eyesight, because of the age, goes dark. So weak eyesight, as we say, right? So after 40 years, the first would be when we are using near vision, the near vision goes away. It becomes weak. So all the tasks that we were able to do a few years back, we're not no more able to do them, right? We call them technically, we call it presbyopia. Along with presbyopia and near vision loss, there could be a far vision loss as well, because this is essentially due to degeneration. So the first, as I said, would be refractive error or the weak eyesight. That's the commonest we see on everyday basis. The other is cataract. The cataract normally starts after middle age. It can start any time after 40 years, 50, 60. So that is another thing we see. Cataract is cloudiness of the lens. The third is glaucoma. Glaucoma means, we'll discuss in the subsequent thing. Glaucoma means that when the pressure inside the eye becomes high. Then the other factors are mainly diabetes. Diabetes can impact the retina. So all the diabetes and blood pressure and all the retinal disorders. So these are the main reasons why people above 40 have a tendency to have some, they can have a weak eyesight as the age. There can be very many reasons, but these are the more common ones.
Thank you, Dr. Sumit. Since we talk about diabetes, we all know that nearly 30%, 40% of the healthcare industry have one of the major reason is high BMI and diabetes. So I'd like to ask Dr. Diljit that what is really important for all diabetics to know. For that matter, even pre-diabetes, does that really lead into any consequences? Anything which our patients, viewers should know about diabetes and eye conditions.
First of all, thank you, Dr. Afia, for the very, very kind introduction. And a big hello to everyone out there. And we are looking forward to any queries regarding personal queries, also regarding eyes or the services at Prime Hospital Eye Department. You can leave a note in the comments. Coming back to diabetic retinopathy, unfortunately, I think diabetes has become more of a pandemic now. And I would suggest that for diabetes as well as diabetic retinopathy, it's important to have a holistic approach. This means that we as doctors and patients, we need to work together as a team. Patients need to cooperate and be a part of the treatment by managing their metabolic, the blood pressures, blood sugars, lipid profiles, uh, take care of obesity. And we as doctors at Prime can help them with the advanced technological support. This is very interesting because thankfully we have the sufficient tools to deal with diabetes and diabetic retinopathy at Prime Hospital. It involves the diagnosis where OCT, OCTA, and FFA. These are various tests which are done to study in detail the 10 layers of retina as well as the choroid. These are the parts of the eye which are prone to getting damaged because of uncontrolled diabetes. After this, the treatment part, we provide in the form of injections. These are fine injections which are given directly inside the eye. The person is completely awake and alert when we do this. It sounds a bit scary, but it isn't. It's a very simple procedure. And this takes care of any bleed or any swelling in the retina inside the eye. Then comes lasers. Lasers, in addition to the conventional lasers, there are advanced lasers options like pattern lasers or navigational lasers, where with the help of the previously discussed procedures like OCT and FFA, we navigate through the healthy retina to treat specifically the diseased retina. Third comes in this lasers itself, we have a Pascal laser in which we are treating the diseased retina, reducing the collateral damage to the healthy retina. Then comes finally for extremely advanced diabetic retinopathy surgical option. In that too, we lead the way by providing very fine sutureless surgical options, which could be done in topical anesthesia as well, with 27 gauge fine instruments. So overall, I think we are prepared to take up all the challenges for treating diabetic retinopathy. But eventually, I feel prevention is better than cure. And
Thank you,
that's it from my
Dr.
side.
Yeah, thank you, Dr. Diljit. Dr. Sumit, since Dr. Diljit correctly said prevention is better than cure, what is the recommendation for eye checkup for any diabetes or, for that matter, hypertensive patients?
Well, the recommendation is that once you have a diabetic retinopathy, that diabetic retinopathy means when your retina actually gets affected because of the diabetes in the form of hemorrhages, there could be cholesterol deposits, all the stuff. So every 6 months is the normal norm. But till you do not have any signs of diabetes in your eye, then once a year is good enough.
Okay. So once a year. And for hypertensive patient, it is the same recommendation?
Yes, for hypertension, basically the screening is not as strict as the diabetes, but I would just suggest once a year should be good enough. Until
Should be
unless you
good
have
enough.
yes, until unless you have some side effects.
And what do you see people behavior? I mean, we all know what is the number of diabetes currently in UAE or across the world. You people, you are more senior doctors, and you must be knowing the behavior of the people. Do they really take it seriously? If anybody gets into diabetes, is it really that the general practitioners or the physician are recommending the immediate eye test or yearly eye test? How much you see what is happening in the OPDs?
Yeah, in the outdoor area, again, it's variable. So, like I would say, the younger patients are tend to be more careless. So the younger the patient, they take their bodies for granted, like in 40s, 30s, 50s, even early 50s. So they are, but the more elderly population is a bit more vigilant. Maybe it's the age factor, the general carefulness. But the GP awareness is good. So most of the doctors are sending us for screenings. Most of the doctors, but strangely enough, there still are patients who have never been told that they need to go to a doctor for eye screening by their respective ophthalmologist, the general practitioners, the medicine consultant.
Absolutely. So it's very important for all of us to know that one is that once a person is diagnosed with diabetes, he has to go through an eye checkup.
Yes.
Irrespective whether you're a general practitioner, physician, or endocrinologist have recommended that or not, it is very important and alarming since you'll be knowing what is the status of your eyes. And at the same time, please, if you are diagnosed with diabetes and it's a long-standing diabetes, please do not get worried. As Dr. Diljit correctly mentioned, a lot of things can benefit the site. As we all know that we are here to clear the fog, so we really don't need to worry about things. But it's just that the correct action at correct time can save a lot of things. And if we don't see, it is definitely going to be an issue. So. Dr. Diljit, I would like to ask, what are the latest advance in cataract management? First of all, let's discuss a little bit about the cataract, what it is, why it happens, who are the people, what are the signs and symptoms, and then probably the latest techniques.
As Dr. Sumit said, cataract is basically a change in the normal clear lens inside the eye. Cataracts can happen in any age group. It could be there in a preterm 7-month-old baby, or it could be not present in a 70-year-old elderly gentleman. So it can happen at any age group, first of all. And definitely, it has a strong association if the person has systemic comorbidities like diabetes, uncontrolled diabetes to be specific, history of trauma, but the important thing is cataracts lead to compromised quality of life, and that is what matters the most. So our aim in treating cataracts is targeting that the person's quality of life should improve. Thankfully, at presently, the cataracts are treated with a complete treatment profile being right from evaluating the cornea preoperatively, the front part of the cornea by corneal topographies, the inner coating, the inner layer of the cornea by speculars, then perfect and most accurate assessment and biometry or reading from the eyes are taken. These are important to calculate the lens which is implanted inside the eye. This is also done by advanced optical machines. And then comes the lens which is implanted in the eye. The more advanced lenses are multifocal lenses, multifocal toric lenses, or toric lenses. Earlier, the conventional lenses were monofocal. That means after the surgery, the person still needed glasses to read and maybe for distance. But multifocus and the other advanced intraocular lenses, the power is embedded on the lens in the ring format. That's why the dependency on glasses after the surgeries is very limited. So that's a very exciting thing for people who don't like to wear glasses or who have an active lifestyle. So they practically become glass free after a cataract surgery. So that's the beauty of the new techniques being introduced for cataract management.
Okay, thank you, Doctor. Doctor Sukhi, I really want to know what is the ideal time a patient should come actually for the consultation when it comes to cataract.
Well, actually, if you go by the norms, it's a subjective thing. So it's like some people may have advanced cataracts and they still are happy with it. For example, retired persons, people who are restricted within the houses, people who are very elderly, and there could be some who just have initial cataract and they feel handicapped, very young, very active people. So, or the location of the cataract as well. So, if it is right in the center, it will disturb you more. If it is in the sides, on the side of the lens, it might not disturb you till late, right? So, the dictum is the thumb rule is that if your lifestyle is being affected, as Dr. Diljit said, by the cataract, your quality is compromised. You are compromising your everyday activities because of the cataract, which is not, of course, correctable by the best possible glasses. Of course, this stands. First, we try to improve it with glasses. But if the glasses are not able to give you that kind of vision, and you have to compromise your lifestyle, that is the time you have to go in for the conference.
Absolutely. Here I really would like to ask now, we will continue with the topic for the glaucoma. Since you mentioned in the beginning that the near eye sightedness, cataract and glaucoma are the major probably people concerned in the OPD. Anything else, doctor, which you see more in numbers and there is a concern that people still don't know about it?
Yes. Uh, See, glaucoma and all are in UAE because of the relatively younger population. I do not see it too much personally. I know about Dr. Diljit's experience, but my experience, I see it, of course, but I do not see it as prevalent as in India, let's say, because where there's a lot of elderly population. But one thing which I see here is surprisingly, which I'll discuss, is lazy eye. Now, lazy eye means that one of the eyes not as strong as the other one. So one is a weaker eye, and that goes undetected at birth because basically we see with both the eyes, right? So when we see with both the eyes, one eye, the weaker eye gets, kind of camouflaged with the other eye. So the other eye takes over and the person doesn't really know. So that is the lazy eye. That is why it's important that even if your child is seeing well, at least get him tested once a year. Because lazy eye, if beyond a certain time, once the child is a teenager, it becomes very difficult for the lost vision to bring it back.
So you mean to say that, okay, but let me ask this way, doctor, what is the recommended age a child should also come for the eye checkup?
Well, preschool years is the time, 3 to 4 years, as soon as the child starts seeing. And in exceptional cases where the child is very, very young and is not able to navigate, for example, he bangs into the wall, he cannot see people, he can recognize people, then we have to do some special measures and check the vision and give him glasses. But most of the time, I would say 3 to 4 years.
Thank you, Dr. Smith. In the meantime, I'm requesting all the viewers, if they have any questions, they can write in the comment box. I'll be asking my speakers to answer the same. Dr. Diljit, since we're talking about children, so for example, at the age of 2 or 3, you are finding that it's a lazy eye. So what will be your next route of action or recommendation?
To be honest, lazy eye is something which is not really related to age as such. It is related to the shape of the eye, and there are certain risk factors like preterm babies, low birth weight babies, or if there's a family history. If the child needs glasses, but we fail to give them the glasses at the right age, that's when a lazy eye can set in. If there is a deviation of the eye, but unfortunately, perfectly healthy looking child could also have lazy eye. And it can happen in one eye, it can happen in both the eyes, it can happen in more than one child in the same family. So I always tell my patients that club together the eye evaluation for kids with something significant. Say it's club it with a vaccination, club it with the birthday of the child, club it with the start of the academic year. And coming back to the age factor, our target is to diagnose and treat the children before the age of 7 or 8, because then the results are wonderful. After that, the success of the person, the child achieving 6 by 6 or 20/20 vision dims down with each passing year. So our target is to get the children to the ophthalmologist, because at birth they are examined by the pediatricians. But there's no harm in getting them, even a 1-year-old child, 2-year-old child, to the ophthalmologist for a detailed evaluation.
Thank you, Dr. Diljit. As you mentioned, one of the important point is the family history. Dr. Sumit, is it really important to know family history? And if there is any such family history, what our viewers should know?
Yeah, there are few conditions in which family history does play a part. Like if you start, for example, glaucoma tends to run in the family. Even cataracts tend to run in the family. Cataracts mean congenital cataract, cataract at birth or cataract in the very young age. So even some corneal diseases, retinal diseases. So there are sets of diseases basically involving all parts of the eye, which needs a family history. Then there are especially retinal diseases. There are so many retinal diseases which are absolutely known for to run in the families. So therefore, if you see something abnormal, some retinal disease in the young children, some cataracts in the young children, something which is not, we are not, some glaucoma in the young children, it's always wise to go to screen and to screen
But
the family.
Dr. Sumit, sorry to cut you here. I'm a general practitioner, and most of the time, I don't see anybody who knows the history, family history of eye disease. How really we can increase this awareness overall among families? It's mostly they know about diabetes, blood pressure, or heart attacks. It's very less that I'm sure this has happened to me. I mean, as a practitioner, I would like to know both of your view. Is it really that people know about their genetic eye diseases, which they should consider for future?
Yes, they are supposed to know, but because the practical thing is that they're less in numbers. Let us put it that way, because they're not very rampant. But definitely, as I'm sure all ophthalmologists, Dr. Diljit as well as myself, we definitely counsel the patients whenever we suspect that the family history could be important here. We can also do, we can print some brochures and keep them in a hospital. And whenever the relevant patient comes, we can tell them what all diseases needs to be screened and looked for. We can do
I
that.
think it's a very good idea to make it a part of chronic disease management program. Also, to know your family history is equally
Yes.
crucial, like we have others. So I have another question, very important question. Before the webinar, we have we ask our patients if they have any particular questions. So I received a lot of questions. I'd like your answers on that. Early signs of heart disease. Some of the patients are asking, are they really linked to eye diseases? So, can I also predict the heart disease and vice versa?
When I see the patient's eyes, to be honest, it's not just the heart and the soul I reach to. I end up taking out a lot of secrets which the patient might not have revealed. Simple things like the patient might be a smoker, the patient might have low iron, or he or she might be anemic. They might be using too much screens. The children might be playing too many games. But all that which is left untold by the patients is revealed by their eyes to me. So these things are easily picked up on eye evaluations, and so do the signs of heart disease, signs of diabetes, signs of higher blood pressures. But to be honest, I have had patients who had diabetes for 20 years. It all matters whether the person has taken care of his or her health or not. So 20 years diabetic retinopathy doesn't exist, but it could be that a person who was diagnosed just a year ago would have a full florid end stage diabetic retinopathy. So it depends on how well the person is being aware of his health. Also, it now I have noticed that there's a paradigm shift from whatever I used to see in older patients in the 50s and 60s. Now I'm seeing all those diseases and signs in the younger generation in 30s. So it's not surprising for me to operate on a person for cataract at the age of 30. I have treated patients for diabetic retinopathy at the age of 35, which I would have done probably 7 years ago, a decade ago for 50s and 60s age group. So it's filtering down, it's flooding the younger population now. So that's a sad part. And definitely, when we evaluate the retina, in fact, not just retina, each and every layer from front to back gives us signs about the systemic diseases, even like a disease like thyroid, nerve related diseases. So, all those can reflect in the eyes, and uh, we need to be aware and alert of these things, that these things can cause not just temporary transient vision loss, but they can cause permanent irreversible vision loss as well. So we need to really look into as people as for screening, for regular screening, for regular checkups.
Let me ask this question to you, Dr. Diljit, from Nivosi. I think you can also see on the screen. My daughters keep blinking her eyes, I guess, as a result of constant cartoon on her laptop. What should we do to stop the blinking since it has lingered for months?
First of all, I will love to see her daughter, evaluate her daughter, because it could be just a lifestyle change, and I hope that is the reason, or it could be something more serious where frequent blinking could be associated with a refractive error, where the child might be genuinely needing prescription glasses. And I suppose it's up to us also to limit the screen time. The smaller the screen, the worse it is for the eyes. So mobiles, iPads, laptops, it's better the child switches to a television, a bigger format, rather than the smaller screens at home. But any
Absolutely.
technology will definitely help.
So the answer for Ms. Nawasi is that definitely if the problem exists for more than certain period of time, it's the time you should see a doctor and an ophthalmologist, to be very precise, because we should not keep on thinking that it will get self-corrected. Any new change you should bring to the right doctor. Dr. Sumit, a lot of appreciations for both of you I'm seeing on the screen. So I have another question probably for Dr. Sumit. Directly he wants to ask, what is the time duration using laptop, mobile screen, which might harm eyes? So my additional question to this will be that what is the recommendation for adults and children and geriatric, if there is any guidelines?
Well, there are guidelines given by the American, Ophthalmologist Association. Although they are broad guidelines, and it's not like very strict, but they are. So basically, the children below 12 years of age, we do not recommend more than 2 to 3 hours of screen time. So that would mean a total of television, mobile screens, video, all combined together, iPads, all of them, all the screens, visual display screen videos, not more than 2 to 3 hours till they are teenagers. In the teenagers also, not more than 4 hours. So this is the recommendation as per. For the adults, 3 to 4 hours is the usual time, is the usual accepted time, but we are doing more. And the one thing that I'm seeing as a pandemic, what Dr. Diljit said, like diabetes, is extreme dry eyes in children, young children. So children as young as 8 to 10 years of age, which was unheard of 10 years back, 7, 8 years back. Normally, it was a disease of the middle-aged, 40 to 50 years of age. Now young children are coming. They are unable to what the lady asked. They are not able to open the eyes because they're blinking too much because of the tear film is breaking too much because of dryness. They are unable to open the eyes in the light. So all these are signs of severe dryness. So all these things should be, so 3 to 4 hours is the answer for Mr. Aftab, who's asking that around 4 hours is the accepted time for the adults.
But to be very honest, Dr. Sumit, we all know that work from home culture, everything is on gadgets. What is the best way actually? This Dr. Mr. Aftab is asking the other question. Does brightness plays any role?
Not directly, but it does increase the dryness and also the blue light from the mobiles and the screens. In the long term, it is said, not in the short term, but it can damage the retina in the long term. That means years and years. Like A young child, when he's doing this, maybe in his middle age, might get damaged by the blue light in the mobiles. So that's why if you see the higher end mobiles have a blue filter as well in them.
I think in addition to, a family history of eye disease, we really need to have very clear recommendation that in 10 years, 5 years, 20 years, where your child is leading to. So I
Yes.
think it's very important to talk about it. I have my another question, Dr. Diljit. I would like to ask, what is, LASIK surgeries, and how many times a person can actually get into LASIK surgeries?
LASIK is a very vague term. We could say it's one of the types of refractive surgeries. Now, refractive surgery means we are helping the person to get rid of their prescription glasses. Now, prescription glasses could be for nearsightedness, for farsightedness, for astigmatism. So, LASIK is basically helping the person to get rid of glasses. But this doesn't mean that suppose before even with the best corrected vision is not 6 by 6. Suppose the person will never get 6 by 6 after LASIK. He will still read whatever he read with glasses. He'll read it without glasses. It's a laser procedure which we use to change the shape of the front part of the eye, that is cornea. It's a cold laser, and there are various types of laser procedures. One of them is PRK, in which directly on top of the cornea, the laser is used. Second type, you could say, commonly known as LASIK, is where just like a file, a folder, flap, a flap is created, laser is given, and the flap is placed back. There's another type called SMILE, in which a small pocket is created and the unnecessary extra tissue from the cornea is stripped out. So there are multiple ways a person can get rid of glasses by this. Now, is it safe or not? Whether to go for it or not depends upon the pre-procedure screening, which is done by corneal topography. We do it at Prime Hospital to understand whether this is the cornea of the person. If we have removed -3 from the cornea, it should be still firm enough to support the eye lifelong. So this is what the pre-screening tests help us do. They help us to uh, predict whether the LASIK will be safe for the person or not.
So the second part of the question, Dr. Sumit, how many times a person can underwent LASIK surgery? Because obviously the size, the numbers are changing. What is the ideal way or suggestion for overall? If anybody has undergone surgery probably 5, 7 years back, now needs the another surgery, is there a way out?
As Dr. Diljit rightly said, it depends how much tissue have you removed. No? After a certain amount, we cannot remove that tissue because the eye becomes very, very weak. And there are chances that it might develop a hole or become abnormally curvatures could change forever, right? So, but normally, repeat LASIK can be done in most of the eyes, I would say. So, more than twice is normally not done. So, 2 times can be done in most of the eyes if the eye is healthy now.
Okay. Dr. Sumit, I think we have already answered this question, but if you would like to add, I'm glad Mr. Faz has asked this family history. Probably he might be having something. You have already answered that there are high risk factors in the family history. If we can summarize the name of the diseases, at least people can
Yes.
remind us.
So one would be myopia, that is high minus numbers that tend to run in the family because that can, that have a tendency to cause detachments in later life. So that's why they have to be screened. Then diabetes, then various retinal diseases, there are some degenerations which are you tend to inherit, night blindness also. So these are the screen basically. Sometimes cholesterol as well. High cholesterol levels they can predispose you to these levels. So all these need to be screened regularly.
Dr. Ahmed is asking what is the best implant technique used for pediatric glaucoma, for example, Ahmed's value or Paul tube extra?
Well, there are a lot of valves which are being done for children. So each has their own merits and demerits. So we cannot say which is the best. So it depends upon the condition to condition. But whatever he has mentioned, all the tubes, there is bare walls tube, there's Ahmed wall, right? So nowadays there are some micro incision surgeries as well, right? So we call them MIGs, micro-invasive glaucoma devices are also there. All are good, but it all depends on the condition to condition, which can only be decided by the doctor himself.
Thank you, Doctor. Dr. Diljit, I would like to ask this question. Since he's consulting online, Mr. Savir is asking yesterday, I was on the beach and end of the day, I couldn't open my eyes feeling sand inside it. Pharmacists recommended Tobrax and Optifusion. So generally, we don't recommend over-the-counter medications, but if you would like to comment.
Change your pharmacist. My suggestion, change your pharmacist.
Yeah, absolutely. Dr. Diljit, your comments on this.
My comments would be that it's very tricky to use topical steroids in for anyone without a prescription, because steroids can increase eye pressures. And even after an application of a day or two, they can increase eye pressures. Steroids can worsen any eye infection. So I strongly recommend that Tobra Dex, which has dexamethasone, should not be used without prescription from an ophthalmologist and without a proper evaluation. Optifusion is an ocular lubricant, so it should be okay. It is a safer eye drop at least. But I strongly recommend, in case if there is any trauma, it's best to consult an ophthalmologist as soon as possible, because I do see a lot of patients who try to pass it on even for 3 days, 4 days, and then they end up having corneal infections. And we need to understand cornea is a very precious tissue. It doesn't regrow. So we don't want to play around with a very sensitive part for eye, and especially the cornea. We don't want to play with it by using over-the-counter medicines. So
Absolutely. At Prime, we completely disagree and discourage over the counter medications. We have doctors. Please visit whoever is nearer to you, but it's a matter of eyes. So, Dr. Sumit, what's your message on this since you wanted to say something?
Yeah, I would absolutely agree with Dr. Diljit that steroid, especially these full doses one, they are full blown steroid, should never be given because and this is very common for the pharmacist to give them, because this to some extent gives immediate relief to many people. So like a wonder drug, right? So the pharmacists, they love to use this drug, but this is very dangerous, as she rightly told.
Absolutely. I have another question from Mr. Aftab. I am myopic with 4.75 power. Do you suggest LASIK eye surgery will lead to 100% long time safe?
Mr. Aftab, nobody can guarantee you 100% results, but depends upon your age. Like there are so many factors to be considered, but for this one thing is for sure that if you are above 40 years of age, with this lesson, you will be happy for distant vision, but for reading, most likely you will have to use glasses. There are various ways. One eye can be made for far, one eye can be made for reading, but they are all makeshift arrangements. So I would suggest that if you are ready to use glasses to some extent, for especially for reading, then you will be happy with it. Provided all
Thank you.
the cornea, retina, everything is healthy, of course. That's
Dr. Diljit, we have a very interesting question. As asked earlier, I had LASIK 6 years ago. Now I feel blur again. Like not all of my power, but I got my power back. Do I need one more surgery?
before answering this question, because Mr. Aftab was there, I'd like to add regarding the concern about the duration of screen time. It's a very tricky question, first of all, because we don't want to put a stamp of agreement on whether 2 hours is good, 4 hours is good, or 6 hours is good for different age groups. How I look at is it really necessary for you to use the screen for those many hours? Is it a significant commitment? or it is just for fun part, so if you can avoid the screen, better avoid it. Secondly, if you have had kept aside your number of hours of sleep, if you have done your exercise for the day, then maybe you have earned your screen time. And lastly, we need to be very aware about computer vision syndrome so that we can take frequent breaks from the screens, use the right lubricating eye drops and eye protection. So I hope this helps Mr. Aftab in his queries regarding the screen time. Now, coming back to a person feeling blurred, appreciating blurred vision after LASIK has been done. Now, how I like to answer this is, first of all, we need to know whether the person if initially got a full correction or not. Sometimes under corrections are purposefully done so that with one eye the person continues to read, and for the other eye the person continues to use for distance. Is that the case? Secondly, what is the present lifestyle of the patient? Whether she is having significant dry eyes, which could contribute to blurred vision, irrespective of whether a person has any refractive error or not. And thirdly, of course, if there is condition in which post-LASIK the cornea becomes soft and flexible and starts changing its shape. But if this is there, nothing to worry, Miss Anusha. We at Prime have something called corneal cross-linking, corneal collagen cross-linking with riboflavin, C3R. It's a very good way of treating any such abnormal changes in the cornea, and it freezes the cornea in the present shape, and it strengthens, in fact, the weaker cornea. And later on, we can plan and help you to get rid of whatever residual glass prescriptions are there. Maybe after observing you for 6 months or a year post C3R procedure. So no worries, Miss Anusha. Whatever the condition, whether it's dry eyes, whether it's an undercorrected post LASIK refractive error, or whether it's corneal ectasia, everything can be sorted out. But don't delay. That's what my message is for all my patients. Do not delay. Do not hesitate to approach.
Absolutely. I hope Ms. Anusha had got all the answers. As Mr. Shadab is asking, I think we have already discussed a lot of things about recommended screen times. It's mostly that parents need to give time to their children so that they can reduce the screen time. I think as parents, most of that it is that in today's busy life, it's the easy gadget to give to kids so that they keep on playing or gaming on it. We are also responsible for the same. So, Dr. Sumit, a question we can discuss from Miss Samra Obai. I have a papule next to my eye. What's your suggestion? It's very comprehensive question,
Yeah,
but then probably we can guide.
it's a very open kind of thing. What she perceives that as papule could be a chalazion, like a swelling in the gland of the eye, or it could actually be a skin tag, or it could be any small benign lesion growing in. So most of the time, it all depends where it is, how big it is, how problematic it is. So if it is giving you problems like opening, closing of lid, mechanical irritation, if it is unacceptable to you systematically, and the surgeon decides. So we have to see, and most likely, most of the such papules can be removed, but it needs to be seen what it is actually. But it should
Yeah.
not be.
Cannot be teleconsultation all the time. You need to physically see the doctor as well.
Yeah.
So yeah, like I believe Mr. Aftab is liking the webinar a lot. So my question I wanted to ask, because I have received this question from one of our patients: what is the best food for eye, or to improve vision? So in other way, does junk food diet can harm eyes in any way? So we can probably answer both.
Who's taking this? Music or me?
Dr. Suki, you can please proceed with this.
Okay, okay. Well, honestly, if you ask me any direct linkage to the eye problems, no. But indirect, yes. Like how like junk food can cause diabetes, cause hypertension, So indirectly cause cholesteremia, can damage your kidneys also if you take it. So or indirectly, yes. But if you ask me anything direct, it can harm in the sense that if you don't take healthy foods, these junk foods are very poor in antioxidants. So indirectly they harm your that way. So it's a poor diet. So leading to a poor diet, it eventually indirectly damage your retina. But direct harm, I'm not sure. Most likely no.
Thank you. As we're proceeding towards end of the session, I have very important questions to ask. We'll be trying to, cover all the important few questions. Dr. Diljit, can eye strain cause dizziness or headache?
Definitely, it can cause. It it's not just dizziness or headache. It can even cause mood swings, irritability. Because I do see a lot of patients. So there is a cross referral from a neurologist to me, and we realize that it's dry eyes actually. Is the person is absolutely healthy. He doesn't need anything to do with neurology as such. But when we treat the person, the headaches are gone. This is mainly linked with dry eyes, which could be again linked with the lifestyle of the patient, lack of sleep or irregular sleeping hours. This definitely it definitely causes dizziness and headaches. Migraines can be triggered because of the lifestyle.
Dr. Sumit, what is the recommendation for protective eyewear like sunglasses overall? Because it's a trend, especially when your country in UAE it's very hot outside. If anybody wants to buy, what is your recommendation? What is to taking care?
Depends upon the profile of the patient. Like, for example, if the patient is working in outdoor workers, so we recommend very good ultraviolet absorbing, blocking sunglasses because they can also cause some degeneration in the eye, like pterygium, or some, and they can also cause some allergies. Like some children who have got allergies, we need to protect them from sun, dust, so protective eyewear means standard glasses with ultraviolet blocking glasses. That's one. For the young children who are using computers, as I said, blue filter, anti-glare screens, anti-glare coat on the glasses. This is what we normally recommend.
Okay.
So this is the standard
This
treatment.
is the standard, at least they should know. Dr. Diljit, since we are doing some rapid questions, how long it is safe to use a bottle of eye drops? It's a very common thing, Generally, most of the places they keep it in the fridge once they open any kind of eye drop and probably use it as and when they require. That's a general tendency of most of the people. But what is the actual recommendation we should follow?
It's a very relevant question because we need to understand that eye drops nowadays come in very different packages. One of them is a single dose, which can be reused for the same day. Then the second one is the multi-dose, the regular plastic containers, which ideally, once the sterile seal is broken, should be used within 1 month. And there are the third type of packages with special filters or pump systems, which could be used longer. But what matters most is that where are they placed? Where are they stored? The temperatures should be ideally below 25, 26 degrees wherever they are placed, not kept in direct sunlight, like not left in the vehicle to be boiled and used later. So these factors also matter. But we need to understand that what happens if we use it after a month. Sometimes people are lucky and they get away with it, but we need to understand the efficiency or the efficacy of the drop reduces significantly once the expiry date is done with. And this expiry date is not what is printed on the box. It could be 2024, but it starts from the day you have opened the seal to 1 month from that day. And I strongly suggest my patients that they should note down the date of opening on the box, store the eye drop in the box in which it is provided by the company. And if not taken care of, I have seen a lot of patients who end up having allergies, corneal
More of
epithelial defects, eye surface, chronic eye surface disorders, and of course, corneal infections as well. So it's an extremely important point to be noted how the drops are used. In fact, sometimes it's a family business. Like the husband's eye drops have been used by the wife, the child's eye drops are used by the parents. This causes cross contamination, and it's definitely not recommended.
Absolutely. Dr. Sumit, is it safe to rinse eyes with contact solution?
No, I
Contact
would not.
lens solutions?
No, I would not suggest that. The best thing is to rinse the eye only with the tear drops or the eye drops recommended by the doctors. So the contact lens solution should only be used for the contact lens dipping, not rinsing your eyes. So only as per the recommendations, not more, not less. So as far as possible, only use those things which are recommended by the doctors and which the contents of what are written on the bottle.
Thank you. Dr. Diljit, is it safe to use eyeliners on daily basis, eye makeup, eye serums, and eye mask regularly?
It's a very controversial question. No, but I'd like to answer it in a different way. Is that uh, there are expiries on each product, and that also just like eye medications, they have 6 months after opening. So even on all eye products, I ask my patients to write the date when it was opened. Also, the storage of all the eye products, it has to be in a cooler area. So this will help us to know whether, even though it's not expired, it is still safe to use, first of all. Secondly, even if you need to use it for professional purpose, or you will like using it, there's no harm in using it on a daily basis. But how do you remove it matters most. At the end of the day, it has to be fine cleaning of the eyelid margins, especially needs to be done. Otherwise, in the long run, we do end up seeing patients with eyelid infections. And I personally, as an ophthalmologist, don't recommend the false eyelashes or contact lenses, cosmetic contact lenses on a daily basis, because that is something we could avoid.
Dr. Sumit, eyelid surgery for cosmetic purpose, is this recommended?
Well, recommended means depends upon again. It's a perspective. There are two parts. One is the purely cosmetic part, and sometimes it could be eyelid surgery could be therapeutic as well. But if you're talking about the cosmetic part, then yes, if it is done by a trained surgeon, it's a pretty simple procedure. But then it is prone to risks as well. So despite a good surgery, sometimes you can have serious infections and the damage to the eye. But they are rare, of course. The one thing is for sure, you should always get it done, only one, when the condition is severe and the condition is very cosmetically unacceptable, not at the very start of the condition, and by a properly trained doctor.
Dr. Diljit, what is the reason for eye bags? Can they go away?
This is we do these procedures at Prime Hospital. I do these surgeries, and it's basically when the upper lid becomes the skin of the upper lid, the skin and the underlying muscle of the upper lid, when it becomes loose, we end up seeing the spores on the eyes, upper eyelids, and when the lower lid gets involved in pseudo fat herniation, we call it. So that is what eye bags are all about. So basically, eye is a soft organ. It is sitting inside a hard bony cage. So to provide some cushioning, there is a good fat. This is not related with obesity. This is a normal fat which is supposed to be there. Over the years, because of rough handling of eyelids, this fat bulges out, and that is what is fat herniation or bags. And we do the procedure surgeries with good results, and just like the upper eyelids, the lower eyelids can also be tackled pretty conveniently.
Dr. Sumit, most of the people I have seen, and everybody must be seeing that yellow bumps around the eye areas, progmies and thalamus. What are they and how to get rid of them?
Yeah,
The technology.
they're called xanthelisma. So they are basically a collection of cholesterol. Not every person who develops these yellowish bumps will have cholesterol, but nearly half the people. So if 10 people have this kind of, five of them might have high cholesterol. So the treatment is two ways. If they are not too advanced, they can be removed by some lasers. Dermatologists can use them, or they can be even removed surgically as well. By
But will they
small,
come back again? Will they recur again if it's
yes,
already
yes,
high cholesterol?
yes. They already, if the cholesterol is not controlled, they will come again for sure.
They will come back again. So
Yes.
anybody
But
who have these things, so they need
yeah,
to see through the cosmetic
these are
surgery.
very easy surgeries.
Yeah. Uh, Dr. Sumit, I also have one question for you. What are eye floaters?
Well, eye floaters are nothing but they are a sign of degeneration. What happens is the eye inside the eye there's a jelly which maintains the shape of the eye. Just like a blood in the body, there's a slight jelly in the eye. So that jelly, with the time, after 25 or 30 years of age, it starts becoming liquefied. So it becomes start becoming watery. Jelly is semi-solid, but when it starts becoming watery with the aging process, it can lead to floaters. So those black spots continuously keep on, uh, rotating in the eye, and we call them floaters. So they might appear as mosquitoes, some flies, some say snakes. So we ask the people to ignore them most of the times. But if these floaters are associated with lightning flashes suddenly, and they come suddenly all of a sudden, then you definitely need to go to a retinal surgeon or even an ophthalmologist to check your retina, because they could be sign of a detachment, retinal detachment, which could be a serious thing.
Thank you, Doctor. Dr. Diljit, why does the eye keep twitching sometimes? Is there something alarming?
I have in my practice seen this pretty often. The basic reasons could be very common ones are dry eyes, but it also could be because of vitamin B12 deficiencies, and also sometimes post viral infections, it leads to twitchings. But there is something called blepharospasm, where the eyelids, for no reason, no pathology assess, they start twitching, and that's when Botox comes into role. And this Botox is not for cosmetic purpose; it is to relax the muscle around the eye so that the eyelid no longer twitches. So,
Thank you. Thank you. Look, so with eye warning signs, something really not to be missed for anyone.
Yes. Well, one could be, as I already told, floaters, like sudden flashes and black spots appear in your retina. So that should not be ignored. The other is, blackouts. When you actually see blackouts in the eye, blackouts means sudden dimness of vision lasting for more than 10 to 15 minutes. Not like few seconds, but 10 to 15 seconds. They are not to be missed, because that could be severe obstruction in the flow of the blood to the eye and the brain as well. So like it's like a stroke of the eye. So that can be very dangerous. That could be. The third is sudden pain in the eye. Pain in the eye, it could be, or pain which is growing continuously. It could be glaucoma, angle closure glaucoma, as we said. So all these things, I would say, should not be missed.
Thank you, Dr. Smith. As we have already crossed our timings for this session, I would like to take a home message from you and then Dr. Diljit as well.
Okay, so I'll start first.
Yeah, please go ahead.
All right. Well, the message is, first of all, never to ignore, be cautious on your health, be it your general health or your eyes, and get yourself screened regularly. We have now, I mean, in all the specialities, here in Prime, in general, we have so much advanced technology. Take advantage of the advanced technology and get yourself tested. Do not ignore any symptom, anything, any deviation from the eyes. Do not ignore. Take care of your children. Do not let them be too much on the gadgets, because these are causing additional jumps in their powers as well as extreme driving. So just be having the caution. Not be You should not be afraid, but just be more cautious. That's it.
Thank you, Dr. Smith. Dr. Diljit.
I'd like to thank all of you. We are really thrilled that you were here. You gave your precious time to us. And what I like to add on is that we need to understand that eyes and eye evaluations and eye screenings are not limited with age or disease. Each and every person, whether it's a newborn child till the age of 70s, 80s, we need to. I have patients who are 95 plus age group. So eyes need to be evaluated and screened, checked. Get your eyes checked on a regular basis, because as I said in the beginning, prevention is better than cure. We are there, the advanced technologies are there, thankfully, in ophthalmology. uh, it's leaps and bounds of advanced technology which is aiding us to treat practically each and everything, each and every disease of the eye. But still, prevention is better than cure, and it would be great to have folks on board to get your eyes checked for the entire family actually.
Thank you both the speakers. It was an honor to host this session, and I have personally learned a lot. I hope that all the viewers have solved their queries. If they still have any query, they can always email to us. Dr. Sumit is available for consultation at Prime Medical Center Nahda as well as in Prime Hospital, and Dr. Devjit, you can always book an appointment through our mobile app with her in at Prime Hospital. This was Dr. Asya with you. I hope we have cleared all the fogs today, and see you in the next session. Thank you so much for having us with us.
Thank you.
Thank
Thank
you.
you.
Thank you. Thank you so
Thank
much.